Each year, almost 44 million American adults and 13.7 million children experience a mental disorder. In fact, mental illnesses are among the most common conditions affecting health today and span all walks of life. Researchers estimate that mental illnesses, including indirect costs such as days lost from work, cost America tens of billions of dollars each year. Mental illness refers to a group of brain disorders that cause severe disturbances in thinking, feeling, and relating, often resulting in an inability to cope with the ordinary demands of life. The good news is that most people who have mental illnesses, even serious ones, can lead productive lives with proper treatment. Symptoms of mental illness can appear as early as childhood. In order to intervene before mental illness becomes more serious, it is critical for parents and other care providers to know the warning signs of childhood and adolescent mental illness. Here are some things to look for. Does your child seem angry most of the time, cry a lot, or overreact to things? Does your child avoid friends or family, or seem to have lost interest in things usually enjoyed? Does your child destroy property, break the law, do things that are life-threatening, or use alcohol or other drugs? Does your child struggle with poor concentration or declining grades? Does your child feel that life is too hard to handle or talk about suicide? Or is your child obsessed about how he or she looks, experiencing unexplained changes in sleeping or eating habits, or often complaining about headaches, stomach aches, or other physical problems? Is your child extremely fearful? If you answer yes to any of these questions, talk to your family doctor or pediatrician about your child's feelings and behavior. Together, you may decide that your child and family need help from someone with more mental health training. Recognizing mental illness in adults is just as crucial, and unfortunately, sometimes just as challenging. Part of the problem lies in the stigma often associated with mental illness and a fear of admitting to mental and emotional problems. As a result, those experiencing symptoms of mental illness often downplay their severity. It is important to realize that your health care is kept confidential and is in your control. Though this video could not possibly cover all the symptoms of various mental illnesses, the following warning signs may indicate a need for a medical evaluation. Changes in thinking or perceiving, including hallucinations, delusions, excessive fears or suspiciousness, and an inability to concentrate. Changes in mood, such as sadness coming out of nowhere, unrelated to events or circumstances. Extreme excitement or euphoria. Pessimism, perceiving the world as gray and lifeless. Expressions of hopelessness. Loss of interest in one's pleasurable activities, or thinking or talking about suicide. Changes in behavior, including isolation from others, hostility from one formerly pleasant and friendly, indifference even in highly important situations, inability to express joy, inappropriate laughter, irrational statements or peculiar use of words, drug or alcohol abuse, forgetfulness and loss of valuable possessions, bizarre behavior, skipping, staring, strange posturing, or unusual sensitivity to noises, light, or clothing. Physical changes may include hyperactivity or inactivity, or alternations of these, deterioration in hygiene or personal care, unexplained weight gain or loss, and sleeping too much or being unable to sleep. Keep in mind that the symptoms of mental illness are often cyclical, varying in severity from time to time. Also remember that in many cases of apparent mental illness, other diseases, such as hypothyroidism, multiple sclerosis, or a brain tumor, are found to be the cause. For this reason, a thorough physical examination should be conducted first to rule out other causes. If these signs and symptoms still describe you or someone that you care about, talk to people you trust who have experience in mental health. For example, a doctor, nurse, social worker, or religious counselor. Ask their advice on where to seek treatment. A nearby university may provide affordable treatment. Otherwise, check the yellow pages for mental health care providers. State and federal agencies also offer valuable information and resources nationwide. Mental illness is a real debilitating disease that can affect you or someone you care about. If you suspect that you may be struggling with this disease, take action. Again, treatment is available, and you don't have to deal with mental illness on your own. And if someone you know confides in you about their mental illness, direct them to the resources available. Over time, if left unattended, mental illness can lead to such things as drug and alcohol abuse, trouble with the law, and a deteriorating quality of life. However, treatment can often lead to a more healthy and productive lifestyle.